Hello, it's John Kanellopoulos from Center here in Athens, Greece, the LaserVision Ambulatory Surgeon, clinical professor of ophthalmology at NYU Medical School, New York City, New York. Here's our laser room. We're getting set up with our VisionMax 800. Very exciting day. Although we're in the beginning of August and most Greeks are on the beach, we're here correcting myopia. We're seeing here zooming in to the cornea, adjustment, cycle rotation, flap ready. Video is times 8, but the preparation time for the VisionMax 800 is just 8 seconds. And then the second easy part, go in and remove the lenticule. Done. Right eye is done. We're going to jump to the left eye now. Same thing. Oops. Showing you here the cycle rotation confirmation on the VisionMax 800. A great asset. We reported on the 500 having that as a disadvantage, not being able to center electronically and cycle rotate. Now with the help of the IOLMaster 700 it does so. Here's the other eye of that same patient. Again, things here are speeded up 8 times, but the concept remains the same. Minimal manipulation of the lenticule, removal, all done, flushing out, drops. Next patient. And more of the same thing. And Smile Pro has become our go-to procedure for several reasons. In Greece in particular, the environmental factors, especially in the summer, are really prohibitive of PRK, which at sometimes we have to perform due to cornea restrictions, and even LASIK. If you consider the strict precautions of not rubbing your eyes, not getting anything in the eyes for several days, antimicrobial protection, in essence, and now with experience of almost 2 years and hundreds of Smile Pro eyes, I can say that it makes sense, especially when you're treating younger patients that may get carried away and not use absolute strict precautions. It really makes a big difference because once one of these cases, and we're seeing here in continuum, and I'm just flowing in the cases of the day. If I'm not mistaken, we did 12 eyes smile today, and one eye, a young gentleman who came to us from the UK, Birmingham in particular. We're going to see that in the end to correct the advancing keratoconus with our AthensProtocol CXL signature procedure. So I was saying that in the clinical reality of performing a smile procedure, just like the one you're seeing here in the great entity of cycle rotation adjustment, we saw how that works earlier, and removing the lenticule. In essence, if you did nothing further in this eye, it would have minimal risk of inflammation and infection. We use the same precautions that we do in LASIK and PRK, meaning no eye washing, nothing in the eye, no eye rubbing for 5 days. But in Smile, this is almost a redundant precaution because even if they shower the same day and they use the drops after the showering, it's very unlikely something can go into the Smile and the interface, and especially if we consider day 1, 2, or 3. I see no reason why one of our patients cannot go swimming in our wonderful Aegean or Ionian seawaters the day after, considering how fast the recovery is in these cases. So we're moving on to case, I think either number 3 or number 4, and you're getting the same theme, that consistency here in having a lean surface. We use alkane drops. Proparacaine in the US would be the equivalent. Make sure that we swipe with a moisturized XL sponge to have no particles or mucus or meibomian gland secretions present in the interface. It's very gentle and comfortable for the patients because they do not lose their vision. Things do not black out during the engagement with your VisionMax 800, and they can actually see green blinking light as their fixation target throughout the laser lenticule preparation, which has made a huge leap of over half a minute with the VisionMax 500, the experience that we have reported extensively, especially in comparison to topography-guided LASIK, and is now 8 seconds. It's not only the speed, though, it's the cycle rotation adjustment, the fact that the settings on the VisionMax 800 gives us, as you can see here, an invariably very smooth interface, both on the lamellar cut and the lenticular cut. And now here we are on a keratoconic patient. You can see minimal cornea thickness, 420 on the OCT. It's kind of critical, is 25. There's no more room to waste. If the thickness goes under 400, and this young gentleman can definitely not wear contact lenses. We're enhancing here the anesthetic. One of the most timid patients we've done, we're doing a PTK here, 40 microns, 8 millimeter diameter. You can see how it breaks through the epithelium at the area of the cone. And we're going to come in with a topography guided, as you can see here, just treating 2 diopters of myopia, 2 diopters of astigmatism. His refraction is -5, -8, and then cross-linking to complete this AthensProtocol case. Hope you found this speed running through our surgical day today, August 5th, 2025. Definitely has been a pleasure having you run along. Thanks so much, John Kanellopoulos from Athens, Greece.